Hey guys, this is Kevin Taft. He's my victim today.
Yes.
We're going to talk about how to work on low backs. If I work on someone as a therapist and I work on their low back, I would put them on the table. So Kevin, go ahead and climb on the table there. So if I'm working on someone, I like to work from a side angle. So people complain about low back pain and they have some kind of tightness down here because they were deadlifting heavy, or they caught a clean wrong, or for whatever reason. And most people will just take a lacrosse ball, lay it on the ground and put it right there and press that direction. And the lacrosse ball is pressing that way. I find it much more effective to press down this way when I'm working on someone's back muscles, their QL. And so what you want to look for when you're working on yourself is find the area in between the bone of the pelvis. It feels like there's bone here. The upper rim of the pelvis is here, and then the rib cage is up here. So go in between those 2 points and work down this way, and I'll show you how to do that. This tool right here is a good way of getting sideways on the back versus anterior to posterior, It's going to get sideways. So what you do is you hook this little knob underneath your back like this, and you roll over onto the side. And you can see where it's placed if you look on the back over here. It's right there in my back. My knees are up and bent, just like Kevin's were on the table. And then I press this handle away from me. And when I do that, you can see the little knob on my back press up into my back in this kind of a direction. So I'm pressing in, find just the sweet spot. It doesn't feel like it's on my internal organs. It feels like it's on my low back. And then I meet the resistance, and then I just breathe. Inhale, exhale, and I push a little bit more if I feel like it gives a little bit. Inhale, exhale, push in. And every time you exhale, you should feel like you can kind of just let it sink in. So that's one way. The other way is you take a lacrosse ball or this big supernova ball, and most people just lay straight on it from the back like that. And I don't feel like it gets the pressure that I'm looking for. But if I turn my hips to the side, and again, I'm in that area in between the bone of the pelvis and the rib cage, and I just let that kind of sink in. I inhale, exhale, let it sink in. Now it's pressing in that sideways direction, which is a lot better. So if you're experiencing any kind of low back pain and you just want to calm it down, those are 2 good ways of doing it. And you should realize that that's not the only problem. If your back is tight, very often it's your hips that are missing range of motion. They can't move freely in all directions, and you need to get to work on those. So we'll create some more videos for that. But in the meantime, if you just want to calm down the back and get it to loosen up and relax a little bit, try that side angle pressure. If anything feels dangerous or sketchy or unsafe, don't do it. But try to kind of come in from the side versus straight on from the back when working on the QLs. So try that out. Let us know what you think. Talk to you later.